Yeah, sure. Thank you. Thank you for the invite to the panel as well. My name is Carissa Kelly. I'm a nurse practitioner. I've been with Symbian for actually almost a year and a half, believe it or not. Um, I've been a nurse practitioner for almost 14 years, a lot in the hospitalist space, both telemedicine and both on site. So I've experienced for both.
Excellent. Thank you, Carissa. So Carissa, what was your first time hearing about telehospitalist services?
Yeah, so many moons ago now, I did some research as the pandemic was evolving to get up to speed on what telehospitalist services were providing and can do. And I came across Symbian Health. Their mission and goals were right in line of what I want to continue to do as a provider. So I joined with Symbian Health, and it has been a fantastic experience since.
Thank you, Carissa. You talk about your sort of the mission of telehospitalists and the services being aligned with what you want to do. How has your experience as a telehospitalist, since you started work, has that, I'm sure it's changed your work-life balance somewhat. How has it impacted your work-life balance? And do you view telehospital medicine overall, how do you view it as a means of service for hospitals, for people who would like to balance their workload and perhaps have that in-person and remote experience as well? How do you view that, and what would you like to say to nurse practitioners out there like yourself?
Sure. So a little personal tidbit about myself. I'm a mom of 4 young kids. So telehospitals medicine has been a fantastic way to balance what I love doing and my career as a nurse practitioner, but also be able to balance work life and be there for my children. So on a career level, I want to help patients as much as I can. We know that the acuity, to Dr. Patel's point, is growing out there. So how can we get to patient care quickly, timely, what urgent matters need to be addressed? And how can we collaborate with our folks that are in the hospitals, boots on the ground, and be support for them?
Yeah, absolutely. And Carissa, any pros and cons you'd like to share?
Yeah, so I'm happy to say that most of it is all pros. I love collaborating with the cross coverage in the evening and night hours. I think we do a great job in teamwork to take care of the patients. I love being the support for the nursing staff. Again, to Dr. Patel's point, there are nurses that get responses quicker using telehospitalist services. The patient gets cared for quickly. We are able to even intervene and be the starting point for those high acute situations, for such as somebody who's experiencing chest pain. Getting those orders in quickly, speaking to the nurse, triaging and seeing how the patient is doing, and then being able to collaborate and communicate with our providers who are in the hospital. They can go see the patient and say, oh, I have all of these tests already done and these orders already placed before they even get to the bedside.
Any experiences, any examples, Carissa, that you'd like to share with us for the audience out there in terms of your personal experience as a telehospitalist?
Yeah, sure. So I actually had one recently that was really great that I'd love to share. It was working with one of the hospitals we work with, and it was a very admission heavy night for the in-house cross coverage. And there was an acute situation with a patient. We were able to communicate very quickly with the nursing staff and together to get orders placed for the patient, some treatment for the patient, get them stabilized while the in-house cross coverage could get to the bedside. She even said to me, oh, thank God you were on tonight, and thank God you guys are here. She also provided feedback from other nights saying that, the amount that we can handle as the telehospitalist is remarkable, and it alleviates her stress and her workload. So it enables her to go focus on the high acuity patients that need the in-person bedside eval, or focus on those admissions that are flowing in those evening hours. We've also had some really great feedback from patients. So I have many a times gotten to interact with patients and alleviated their anxiety or fears or answer their questions. And that enables us to help the in-house with having that patient have their question answers quickly.
That's amazing. So all across, so you do have some patient interaction as well, where if there's a question that comes up, you can talk to the patients as well, and they have somebody who they
Absolutely.
can sort of talk to sooner than later. And what better thing than that for somebody in the middle of the night? Yes, absolutely. Thank you for sharing.
Absolutely.